RFK Jr.'s health department halts $500 million in mRNA vaccine research. A shocking shift. RFK Jr. makes controversial move to end $500 million in mRNA vaccine research. In an unexpected and provocative development, the U.S. Department of Health and Human Services, HHS, announced on Tuesday its decision to terminate 22 federal contracts related to the research and development of mRNA-based vaccines. This action raises serious questions about the safety of a technology that has been instrumental in battling the COVID-19 pandemic and is acclaimed for saving countless lives. The Biomedical Advanced Research and Development Authority, BARDA, the unit responsible for this initiative, plays a crucial role in helping companies create medical supplies that address significant public health threats. Over the course of the pandemic, BARDA allocated billions of dollars to vaccine development, highlighting its importance in the national health framework. Among the noteworthy actions, the HHS announced the cancellation of a significant contract with Moderna. This contract was aimed at advancing the late-stage development of a bird flu vaccine designed for human use, as well as ensuring the ability to purchase these vaccines in future. This move is not an isolated incident. Multiple pre-award solicitations from pharmaceutical giants like Pfizer, Sanofi Pasteur, CSL Seqirus, and Gritstone have also been rejected or canceled. Overall, the projects impacted by this decision amount to nearly $500 million, according to HHS. However, select ongoing late-stage projects will be preserved, purportedly to safeguard taxpayer investments that have already been made. This announcement marks yet another significant change under the leadership of U.S. Health Secretary Robert F. Kennedy, Jr., known for his long-standing skepticism towards vaccines. Kennedy has shared his vision for revamping policies around vaccines, food safety, and medicine at large. "We reviewed the science, listened to the experts, and acted," Kennedy stated firmly in a public statement. Kennedy's reasoning for terminating these contracts stems from his assertion that current data suggests these mRNA vaccines do not provide adequate protection against upper respiratory infections such as COVID-19 and the flu, though he did not present scientific evidence to substantiate this claim. Furthermore, he mentioned a redirection of funding towards alternative vaccine technologies that promise broader efficacy, even amid viral mutations. This decisive action follows an exhaustive review of mRNA-related investments made during the COVID-19 public health crisis. Since assuming office, Kennedy has initiated a sweeping restructuring of U.S. health policy, even replacing a board of vaccine experts with appointees of his choosing. In the first meeting of this new panel, a vote was taken to ban a widely used vaccine preservative that has consistently demonstrated its safety, underscoring the divisive nature of his administration's decisions. Additionally, Kennedy has commissioned a thorough investigation into the thoroughly debunked link between vaccines and autism. This controversial focus raises eyebrows and sparks heated debates within the medical community and among the public. Unlike traditional vaccines that often use weakened or inactivated forms of viruses or bacteria, mRNA vaccinations function differently. They introduce genetic instructions into the cells of the host, prompting the immune system to create a harmless imitation of the pathogen. This mechanism trains the body to effectively combat the actual virus. Although mRNA vaccines have been in development for many years, the COVID-19 crisis accelerated their journey from laboratory research to widespread use, primarily due to Operation Warp Speed. This initiative, a partnership between the government and private entities led by BARDA, invested billions to expedite the development process. The innovators of this groundbreaking technology, Katalin Karikó and Drew Weissman, were awarded the 2023 Nobel Prize in Medicine for their remarkable contributions, which significantly hastened vaccine development during one of the greatest modern health crises. But here's where it gets controversial. Are these abrupt shifts in policy grounded in scientific reasoning, or do they reflect personal ideologies? As this situation unfolds, what are your thoughts? Do you believe that the decisions made by the HHS under Kennedy are a wise course of action, Or do you think they jeopardize public health? Share your opinions and let's engage in this essential dialogue.